Welcome back, everyone, to Thriving Through Perimenopause. I'm your host, Dr. Anna Glazer, a reproductive and integrative psychiatrist, and your guide on this journey to mastering midlife. This is the fourth in a 6-part video series, and in this episode, we're going to talk about brain fog and mood symptoms, two of the most common experiences that women describe as functionally impactful in perimenopause. Just as a brief review, in parts 1 and 2, what we did was a discussion of a lot of the psychological symptoms of perimenopause and debunked some of the most common myths and stereotypes around the experience. And we also reviewed the science behind the psychology, the science of the hormones, including the prevalence of estrogen receptors in the brain, which is why we're really talking so much about psychological symptoms, mood swings, and brain fog in this particular episode. Part 3 really focused on one of the gold standard treatment options for perimenopausal symptoms, which is menopausal hormone therapy. We debunked a lot of myths and misconceptions and gave you the information and the science that you need to have an informed discussion about that as a treatment tool with your physician. In this particular video, we're going to talk about brain fog and mood swings. Let's start with brain fog. This is a common term that's often used by women who describe their experience. It's not a clinical term. Instead, the clinical words that we often use to describe the experience is cognitive symptoms or cognitive impact or challenges with executive function. But let's look at what it actually means. So some examples of brain fog symptoms, things that you may have experienced in your own world. Have you been perhaps forgetting words in important meetings, maybe feeling less sharp, mixing up appointments, perhaps second-guessing yourself or losing things? All of these are examples of the cognitive symptoms that happen during perimenopause, and it can really lead to a psychological impact. Feelings of insecurity, frustration, anxiety, and overwhelm. Just think about an example. Let's say you've misplaced your keys. It takes you a while to find them. Then you mix up the timing of your important meeting, and when you get there to present, as you're talking, you forget a really important word that's been such a part of your conversational language for such a long time. And it makes you really feel like, what is going on with my brain? It's really frustrating, and it really makes you feel insecure and anxious. The challenge is that it can lead to a lot of fears. One of the most common questions that I get is, am I getting early signs of dementia? Is that what's going on here? And that's really scary because a lot of the individuals who we're talking about, all of you, are experiencing these symptoms in your 40s and 50s. And so this is really hard and can lead to a lot of anxiety. The other challenge is because of the timing. So again, we're talking about women. You are in your midlife. This is really the peak, oftentimes, of your professional career and endeavors. So you are in the meetings, people are listening to you, you are at the top of your game, and it's a really hard time to be going through these symptoms that make such a psychological impact and can influence your executive function, your organization, basically your cognitive experience. So that's why these symptoms are so impactful, both because of the timing, the severity, and the anxiety that's caused by these examples. So let's look at what we can do about brain fog. The first step is figuring out what is the underlying cause. Now, today we're talking about perimenopause and the change in hormones that's leading to these symptoms. As we discussed in the first videos, it was really a decrease in estrogen, progesterone, all of these reproductive hormones. And because we have so many estrogen receptors in all parts of the brain, if you recall in video 2, we really went over the extent of all of the estrogen receptors throughout our brains, particularly in that prefrontal cortex, the front part of our brain that's involved in executive function, organization, planning, and decision-making. So the changing hormones, of course, is the most likely culprit. However, we don't want to make assumptions. We want to make sure that we rule out anything else that might be contributing to this. One of the things that I really work with my patients on is to figure out if there's any underlying mental health condition. One of the things that we often think about in terms of executive dysfunction is signs and symptoms of ADHD. Now, it's beyond the scope of this particular video to really dive deep into ADHD in women. I've definitely done podcast episodes on this topic and discussed it quite a bit in other places. But one of the things to keep in mind with ADHD in women is that number one, it's often misdiagnosed or underdiagnosed, and it's hard to recognize because it can present differently. The other thing to keep in mind is that whatever the underlying mental health condition might be that you may have had your entire life, oftentimes these symptoms can get worse in perimenopause. That means if you've had a history of ADHD, it can get worse in perimenopause. If you've had a history of, let's say, anxiety or depression, and both of those conditions can come with cognitive impacts. Anxiety, for example, is related to a lot of distraction types of symptoms, and that can get worse in perimenopause. So we really need to think about what potential underlying mental health conditions might be undertreated during this experience. And so we need to treat that as well. The next thing we want to really think about and rule out and address, if necessary, are potential micronutrient deficiencies. For example, with a lot of my patients, if they haven't had any recent blood work, we might check to see where they're at in terms of a number of really common micronutrients. One of the ones that I definitely like to make sure to check with my patients is their B12. That is a micronutrient, it's a B vitamin that's essential for cognitive health. And one of the things that I really like to point out with all of my patients and with the clinicians that I train is the difference between optimal and normal. And this is an important distinction to make. When we're talking about doing blood work and getting a result, we want to make sure that we understand what is an optimal range for an individual. Oftentimes, an optimal range is not the exact same and does not overlap completely with a normal range. Normal range is based on the distribution of the population. However, unfortunately, our population, certainly in the United States and many other developed countries, is getting sicker, which means that the quote-unquote normal range is actually shifting over time and may no longer align with what is optimal. And I want all of my patients and all of you to function optimally. So when we get a lab result, we want to make sure that it's in the optimal range, not just the normal range. So let's make sure we've corrected any micronutrient deficiencies. The next thing that's so common for many women is sleep deprivation. How many of you, raise your hand if you're sleep deprived? If perhaps after you've maybe put the kids to bed, you stay up late doing some additional work or some chores around the house, or maybe you have what I would call bedtime procrastination, where it's really the only time that you have for you. So you don't want to spend it by going to bed early, and instead you stay up late and you don't get enough sleep. Maybe you think that 5 or 6 hours, 6.5 is sufficient, because it might be sufficient for some people. But interestingly, they've actually done a little bit of work around this, and women do need more sleep than men because of the differences in our hormonal systems. So I have patients where they think that they're getting enough sleep. Maybe they're getting 6.5 hours. That's really not enough sleep. So we really need to think about sleep deprivation as a common cause of cognitive challenges. Because again, whatever is going on during this experience, the hormones make it worse. The hormonal shift makes it more challenging. The next thing that we really want to think about is environmental toxins. Our world, unfortunately, is getting more toxic. There's a lot of toxins in the world that are impacting our mental and physical health, both in the environment, in the foods we eat, in so many different places. I have a number of patients, for example, who live in very moldy homes, and so mold can affect our cognitive functioning. It can actually cause a whole host of physical and psychological symptoms, so we need to remediate that in those particular cases. We need to look at what are the potential toxins in our environment that might be contributing to our cognitive symptoms. And finally, think about what medications you might be taking. There's a number of medications out there that can lead to some cognitive dulling. There's medications, for example, topiramate, which is one that is not uncommonly prescribed for weight loss. I'm mentioning that just as one example because changes in body composition, like we talked about in the first video, are common in perimenopause. And so some women might choose to take medicines that will help them change their body composition. Unfortunately, some of these medications can have these kinds of side effects. And there's other medications that might have cognitive dulling as a potential side effect, and you need to be aware of all of those potential side effects to make sure that's not the cause of some of your brain fog. So once we've figured out the underlying cause, we can then move on to step 2. Step 2, we target treatment. So in the last video, we really focused on menopausal hormone therapy as a gold standard treatment tool because it can target all of the different symptoms. And of course, it's going to be able to target brain fog as a symptom of perimenopause as well. However, it's not always an option for everyone. And so I want to make sure that we look at all of the other tools that we can use as well and consider the fact that it should never be used alone. One of the tools that I'm mentioning here, for example, is exercise. There's a lot of really interesting data on exercise and how it impacts our cognition. And it's very complementary to be able to do menopausal hormone therapy and exercise at the same time. So menopausal hormone therapy is number 1. Targeting those underlying causes, of course, is an important piece as well. Let's spend a little bit of time on exercise. There's, as I mentioned, a good amount of data on exercise for brain health, and there's multiple different underlying mechanisms for that. There's mechanisms at the molecular level. For example, exercise has been shown to increase brain-derived neurotrophic factor, which helps with neuroplasticity, which is another way of saying it helps with learning. And it also helps with many other aspects of our cognitive function, both at the molecular level and at higher, more macro levels. So we have a lot of data on exercise for mental health. And there's some interesting data on specific types of exercise. One of the things that can be very interesting is if you're doing resistance training, because of the amount of cognitive work that's required to lift weights, because you're doing a lot with proprioception and balance and stability and all of these other parts of your brain, like your cerebellum and so many other aspects of your brain when you're engaging in resistance training. One of the things that I encourage every single one of my patients over the age of 40 to do is resistance training. Of course, it has these cognitive benefits. We'll talk about the mood benefits in just a moment, but then also there's the benefits related to preventing osteopenia and osteoporosis, bone loss, as well as sarcopenia, which is muscle loss. And these two things are essential. So resistance training and exercise are going to help with the physical symptoms of perimenopause and the mental symptoms of perimenopause. The last thing I want to mention in terms of targeting treatment is to decrease your exposure to substances. We can all become more vulnerable to the impact of various substances in our bodies during the experience of perimenopause. That means that what used to affect us less now affects us more. If you used to be able to have 2 glasses of wine without a significant impact, guess what? Maybe now it's only half a glass or a glass. So decreasing your exposure to substances because of changes in how we metabolize these things is actually going to make a big difference in terms of managing some of those cognitive symptoms. Beyond cognitive symptoms, I want to now shift to talking about mood and anxiety, and mood swings being one of the most commonly described issues and challenges in perimenopause. If you recall in the first video, we talked about the most common symptoms, and there was an interesting study that I had alluded to coming out of the UK that did a survey of thousands of women where they asked them what's most functionally impactful. Number 1, affecting more than 80%, almost 90% of women were mood swings. So mood and anxiety shifts are very challenging experiences during this time, and it can come in a lot of different ways. It doesn't just have to be, oh, I'm feeling sad. In fact, it's actually pretty rare that women describe it in that way. What they do describe, number 1 thing that I hear from my patients, I'm more irritable. I'm snapping at my partner. I'm annoyed with my colleagues. I'm getting mad at my kids, and I don't like who I've become. That is the most common thing that I hear from my patients who are going through perimenopause. There can also be an increase in worry, general anxiety, where you're more anxious about various aspects of life. You just tend to ruminate more about the what if questions, what if this or what if that. on various topics in your world. You might no longer enjoy the things that you used to enjoy more, and you might be feeling more down or sad. Sometimes it's described more as a sensitivity, so perhaps that's a word that might fit you a little bit better. And that can happen more so premenstrually. Keep in mind, again, in perimenopause, you are often, especially in early to mid perimenopause, still having cycles, whether they're shorter or longer, whatever they might be, you're still having a premenstrual experience, and oftentimes that can come with heightened sensitivity. There can also be a sense of overwhelm, and that can come from many different places, including, as we were just talking about, those cognitive challenges, that brain fog, which leads you to have less function in terms of executive organization and planning and word finding, and that can all come together to lead to a sense of overwhelm. If you're not getting things done the way that you used to, then you're going to feel more overwhelmed. There can also be a very physical experience of the anxiety shift. So sometimes described as a tightness in your chest, butterflies in your stomach, maybe some nausea or upset stomach. And then it can come with a sense of heaviness or weariness and some appetite changes. Those are some common examples of mood and anxiety shifts that can happen in perimenopause. So what do? We start with the first step again. We figure out what is the underlying cause. The changing hormones, absolutely, that factors in. But what else might be going on that we need to address? In this case, is there an underlying mental health condition that's been suboptimally treated, perhaps, in the past? Do you have maybe a family or personal history of depression, and now it's getting worse because of the changing hormones? Could there be a micronutrient deficiency here again? One of the most common things that I see in my practice are women who are having challenges, who are deficient in vitamin D. Vitamin D, we sometimes think about the sunshine vitamin. It's also a very depression-related vitamin. When levels of vitamin D fall below a certain amount, that can truly lead to symptoms of depression. And I have yet to see one patient where I've checked their vitamin D levels if they're over the age of 30, 35, and they're in the optimal range. Again, remember the difference between optimal and normal. And so it's very rare, even if you happen to live in, let's say, sunny San Diego or Phoenix, wherever you happen to get plenty of sunshine. Although I would actually say that I think a lot of folks in some of those hotter places don't get as much sunshine because it's too hot to go outside. So you stay indoors and you want to protect yourself from the sun. We also know from a dermatologic perspective that we want to be wearing sunscreen to protect ourselves. And so that means that we're getting less vitamin D. So lots of reasons why vitamin D might be deficient. And that means that needs to be repleted in order to potentially help with symptoms related to mood. So we want to replete those micronutrients. We also want to think about other hormonal causes. So in video 2, we talked a lot about different hormonal cascades, including the relationship between these reproductive hormones and the other hormones in our body. And we want to make sure that nothing is awry. We want to make sure that we check to see that thyroid hormone is functioning properly during this time. It can definitely go awry during the perimenopausal transition. So we want to check thyroid numbers because someone who has too much thyroid hormone in their body might feel more anxious, and someone who has too little might feel more depressed. So we want to make sure that all of the hormones that we can check that might be awry are actually back in those optimal levels as well. In this case, when we're talking about mood swings, we also want to think about environmental toxins. The mold that I mentioned under the conversation regarding brain fog can also lead to mental health symptoms, mood swings, depression, and irritability. And medications. There's a number of medications out there that are associated with dips in mood, or conversely, are associated with heightened anxiety. Medications that can lead to a sense of palpitations or elevated heart rate, all of these kinds of things, you need to be aware of those potential side effects for whatever you might be taking, because that could potentially be a culprit for some of your mood swings. So we've done step 1, we figured out the underlying cause, and now step 2, we target treatment. Video 4 talked about menopausal hormone therapy, which again is going to help treat those mood symptoms. And menopausal hormone therapy can be used synergistically with other treatment options. So what are some of those other treatment options? Many of the medications, actually, that we traditionally use for managing anxiety and depression symptoms can be used in perimenopause and can help beyond just treating mood and anxiety symptoms. This is actually really interesting. So a lot of the medications, for example, SSRIs and SNRIs, medications like fluoxetine, paroxetine, venlafaxine, you may have heard these medications mentioned before. These actually have been studied for symptoms of perimenopause. They do treat, yes, the mood and anxiety symptoms, but they can also help with things like hot flashes and night sweats and some of these temperature adjustments that can often happen. So one of the things that can be really helpful is if you choose a tool that's going to have multiple targets. So if you're choosing a medication that can help with mood and anxiety, and it can help with vasomotor symptoms, for example, two birds, one stone. As always, we want to treat the underlying causes, replete vitamin D levels, for example. We talked about exercise a few moments ago, and it has really good data for managing symptoms of depression and anxiety, especially when it's used in conjunction with other treatment options. Mindfulness and meditation has some really good data for managing these symptoms as well. I think sometimes people get a little concerned when they hear that because they tell me, I can't just sit and empty my thoughts. That's not what mindfulness and meditation is about. In fact, you can actually do a mindfulness or meditation exercise while you're walking outdoors. And it's not about clearing your mind. Our minds are always full of thoughts. It's really about refocusing back to the present moment. The example that I like to give is the same way that you might train a puppy, right? The puppy wants to go sniff something over there. They're on a leash. And you just call them back. That's the same thing that we do with our brains. Our brains are like little puppies. They go off on tangents, and we just have to bring them back to the present moment. That's the essence of what mindfulness and meditation is about, is this non-judgmental experience and awareness of our thoughts. And that has really good data for managing symptoms of anxiety, depression, and mood swings. And it can be done in many different ways. There's a lot of different apps out there that can provide guidance. There's online programs, group classes, individual therapies, lots of different ways to engage in a mindfulness and meditation practice. The next thing is psychotherapy, CBT, cognitive behavioral therapy, and many other types of therapies have been shown to be quite helpful for managing symptoms in perimenopause. CBT has been studied particularly and in many different ways through randomized control trials because it's a style of therapy that lends itself really well to that kind of research. And so they've done trials where they've had individuals complete usually about 8 sessions of cognitive behavioral therapy, and they find improvements in cognitive symptoms, in vasomotor symptoms, in anxiety, in depression, in many of the symptoms of perimenopause. There's a number of perimenopause-focused protocols for cognitive behavioral therapy out there. Other forms of psychotherapy work as well, including trauma-informed work, groups, and certain skills-based therapies. The key really is to have a good relationship with your therapist if you're doing one-on-one work or as part of a group, because that rapport, that relationship is essential to the improvement in symptoms. Ecotherapy, I always like to mention, being outside in green spaces, in blue spaces, does wonders for our mental health, as well as breath work, which is a type of mindfulness. We can think about it as a form of mindfulness or grounding. Breath work can really help reduce the sensitivity and activation of our sympathetic nervous systems, which is the fight, flight, freeze system, and instead activate our parasympathetic nervous system, which is the restful, less activating nervous system in our bodies. And that can really provide a sense of relaxation and relief from things like anxiety and mood swings. So a few key takeaways. Brain fog and mood swings are two of the most commonly reported early symptoms of perimenopause that are quite impactful. And individualized treatment is going to require a number of steps, including figuring out the root cause, that is key, thinking about any deficiencies or exposures, and addressing that with a combination of treatment tools. menopausal hormone therapy, exercise, mindfulness, therapy, and much, much more. Up next, we're going to talk about one other really common symptom of perimenopause, which is sleep challenges. See you there.